Welcome to the Risky Healthcare Business Podcast, where we help you prepare for the future by sharing stories, insights, and skills from expert voices in and around the United States healthcare world, with a mission to inform, educate, and help healthcare organizations and individuals ranging from one doctor practices to large integrated systems and organizations throughout the dental, medical, and veterinary healthcare industry with risk, while hopefully having some fun along the way. I'm your host, Scott Nelson, a guy that grew up in Ohio and has been working all over the United States during my 20-plus year and counting career in the healthcare industry, with a commitment to accelerating healthcare performance through creativity, not just productivity. Let's dive in. The National Oceanic and Atmospheric Administration's National Centers for Environmental Information has published research that shows the U.S. has sustained 373 weather and climate disasters since 1980, where overall damages or costs reached or exceeded $1 billion, including CPI adjustment to 2023. The total cost of these 373 events exceeds $2.645 trillion. The first 3 years of this current decade, 2020 through 2029, is on pace to increase from the previous decade, 2010 through 2019, in number of events and cost. Imagine a scenario of being in an area where weather and climate-related adverse events like wildfires, tornadoes, winter storms, hurricanes, or flooding are prevalent. Now keep going with that scenario and add on top of it, happening at the same time, a staff that feels spread thin with staff departures, or a technology issue that has abruptly halted computer services like a cyber attack. A natural disaster might be thought of as a low probability scenario, maybe, depending on geography, but workforce departures can unexpectedly happen at any time. Cyber attacks continue to increase. Financial and legal issues should always be considered. Is your healthcare business prepared and ready to absorb and manage one adverse event? Would it survive two happening at the same time? Many people and organizations will conduct scenario planning exercises with one adverse shock event, if any are done at all. Earlier this year, today's guest, along with his organization, had to manage a real-life event that involved staffing issues at the same time facing Hurricane Hilary at a system facility in Southern California. Today, I'm speaking with Brett McClain about risk in healthcare, including facing multiple simultaneous adverse events, risk types and variations, activities to help plan and prepare for risk events, and more. Brett is the Executive Vice President and Chief Operating Officer for Sharp Healthcare in California. At Sharp, he has direct accountability and oversight for the daily and strategic operations of Sharp's 4 acute care and 3 specialty hospitals, 3 medical groups, ambulatory and clinical service lines, and facilities management and development. His career spans nearly 30 years of healthcare management experience in a variety of operational, consulting, and executive leadership roles, overseeing various hospital and medical clinic operations, where he has been instrumental in leading growth strategies, large-scale capital investments, clinical integration and service area optimization, patient safety and performance improvement, and service line development. Let's talk with Brett about risk in healthcare. Brett, welcome to the show.
Hey, thanks, Scott.
Before we begin talking about risk in healthcare, let's go back to the beginning. How did you get into healthcare and where you are today?
Well, not really purposeful. It kind of just happened. I got hired by a very small boutique consulting firm back in the late 80s after working for a national trucking company, actually, in a management training program. And they focused largely in healthcare, wanted to also get involved in some manufacturing and logistics, kind of supply chain. And so I got hired at a very young age and was brought into this company. It was called West Hudson, fantastic organization, and ended up really, while we did some non-healthcare, ended up really focusing mostly on healthcare. Probably 90% of the work was in healthcare. So spent about 11 or 12 years there working in all sorts of different healthcare organizations, small, large systems, academic, non-community, et cetera, and got to travel the country, got to meet my wife at a project, and here we are, almost 30 years later. Just an incredible way to learn healthcare, to kind of see different models and different markets as well. Ended up being a partner in that organization, and then we sold the company to, when Baxter split into 2 companies, became Baxter and Allegiance, and then ultimately was purchased by Cardinal Health, and then decided to not be on the road so much with 2 brand new children. And so I left and actually went to work for a client.
At Sharp, you have direct accountability and oversight for the daily and strategic operations of Sharp's 4 acute care and 3 specialty hospitals, 3 medical groups, ambulatory and clinical service lines, and facilities management and development. Is there a typical day at work for you? If that's possible, what does it look like?
Typically untypical, I guess, right? Seriously, I think those of us that are, in my mind, fortunate enough to be in operations and to work with the incredible folks who make things tick every day, really, you never know what's going to happen on a daily basis. It's part of the challenge, but it's also for me, part of the excitement. I love dealing with the stuff that are challenges for us and working through those, and then also being able to deal in the incredible successes and celebrations that we have on a daily basis. So, at the end of the day, we're trying to move the needle in terms of our strategy and our performance and our impact here in San Diego to the community. We are the largest provider of healthcare in the community of San Diego. And so just trying to move that along and deal with the bumps in the road. And sometimes there's, 3-year-long bumps like COVID, but there's certainly daily issues that happen that you have to react to. Luckily, have an incredible team that is capable of handling all of that as those issues, arise. But not really a typical day.
Well, with your point about never knowing what's going to happen each day, I'd like to start our conversation by getting your thoughts on how you think about risk in healthcare. You've been involved in many initiatives at healthcare organizations across the U.S. in a variety of roles. How do you think about risk in healthcare?
Well, I think, I think there's a lot of consistency with risk in healthcare over the years. You're always trying to lower the risk for our patients and for our staff. Just in the delivery of healthcare, we're dealing with very, highly technological, practices and equipment and pharmaceuticals and all of that. And that's been the case forever. We learn new things and we learn new ways in which to deal with those risks. But that's been an ongoing kind of part of how we manage the delivery of care. I do think as time has gone on, the risks have changed and evolved and been added to as well. And I would say probably one of the lessons through COVID has certainly been the very real chance and issue and risk of multiple things happening at the same time, not just one big event. And here in California, we have all sorts of natural issues that can happen, as well as, the non-natural things that can happen within our industry as well. And so I think what's evolved around risk for us is the recognition that we need to have processes and people and practices and policies and practice in place in order to deal with unfortunately, multiple catastrophes sometimes or multiple risks at the same time that can stress the organization in ways that probably haven't been experienced before. So, it's trying to take the lessons that we've learned over the last 3 years and put that into practice has really helped us evolve into how we as an organization think about risk as well, not just kind of on those individual certain, circumstances that might happen.
Well, and you mentioned various places where risk can take place and in your experiences at Sharp over the last few years, thinking about patients and staff and beyond, why do you feel it's important to think about risk and be actively planning and preparing for it? What can happen in those risk events or what happened during COVID through your experiences that affects those patients and staff in the overall organization?
Yeah, during the pandemic itself, we all were dealing with kind of the in the moment issues of not knowing exactly what this thing was. It's hard to even put our mind around that about where that was at 3 to 4 years ago, but we didn't really know. And, the amount of work and energy and time and costs and resources we had to put into being able to protect both our staff who are going in to care for people with a largely unknown, enemy here, and also keeping family members and other patients safe as well. So it was that certainly in the moment and having to deal with that. Very fortunate here. I started literally on the day pretty much everything closed in California here at Sharp on the middle of March of 2020, but very fortunate that we had a highly engaged group. We call it the highly infectious disease group, and it had been used in other circumstances in the past, highly engaged. And we actually had a daily, for over 2 years, daily call with about 170 leaders throughout the entire system. This made sure that we all had the most current and up-to-date knowledge of what was going on, but also importantly, as things evolved, changed what we were doing on a daily basis at a system level as opposed to just at an individual facility level. So that was very helpful. Now, I think the real impact that, we had no idea was coming was certainly, the impact to our workforce. And I have never seen, been in healthcare for 30 years, I've never seen something like this in the past. Just the toll in terms of just the physical as well as kind of mental toll under all of us, and folks that just deciding this is not something I want to do any longer, and just changing the whole workforce perspective of working within healthcare. And that is a massive risk for the entire industry. It's probably the one thing that I'm most concerned about and most challenged by, about how do we respond to that in the moment so that we can assure that we have, the workforce of the future, not just for today. So this has really challenged our system. I think allowed us to maybe think things a little bit differently, which is always good. But we're still in it. We're still in that evolution of the healthcare worker right now.
Well, for a long time, healthcare viewed risk as subjects like compliance, so coding and billing, for example, quality and safety, such as errors and sentinel events, complicated legal issues like patient lawsuits. Today, technology is a growing consideration. On Sharp's website landing page, there's a box and a Get Started button for virtual urgent care. Your work crosses the organization and can expand outside. So where is risk in healthcare for you? What are the areas of risk in healthcare that are or should be of concern, should be watched and monitored? You'd mentioned workforce and staff a little bit as well. Are there other areas you focus on as well?
Yeah, certainly. And you hit the ones that I think will usually be on that list. We have a pretty rigorous and meaningful process that we go through on an annual basis to look at what the risks are to the organization. And then the senior level members of our team will go through a process to categorize those as well as to rank them in terms of importance. And we look at them from kind of an inherent risk score, if you will, on just inherently the category. And then we look at the residual risk at the end of the day, which takes into consideration, you got this inherent risk, but what are your business practices to be able to mitigate those risks? And so then, therefore, what is the residual risk? And we look at all of that in every single year, go through, again, a pretty detailed process. And so just to give you a flavor of some of the things we're looking at now, which have not really changed over the last probably 2 to 3 years, the order has, and at the top of the list is absolutely cybersecurity. It is something that continues to be critical in nature for all of us in healthcare, and obviously a sense of frustration for those of us in this work, but also something that we cannot take our eye off any single day. So, just the resources we've had to put into that, the people and the processes and the systems in order to assure that we are safe. We get hits every day, right? Every single day, someone's bad actors out there trying to make something happen. So that is something that is way at the top of the list that has our focus. Again, we talked about workforce, but we also focus as a risk on our provider alignment, right? Our physicians and our community providers out there, as they are going through kind of changes and adaptions that they're having to make through from the pandemic as well. How do we assure that we're aligned with them and providing an attractive place for them to practice medicine? And then here in California, unfortunately, we put the legislative risk pretty high up. It's not just on a state basis. There's certainly national pay practices and just the challenges that we're all having right now in Medicare and Medicare Advantage as well. But on a state basis here in California, we have a very active legislature, and we put a lot of time and energy to monitor the things that they're working on, make sure that we're taking a look at the impact to Sharp specifically so that we can communicate and educate to our legislators. We spend a lot of time doing that. Every couple of years, you've got a big percentage of brand new folks in the legislature that may not know a lot about healthcare. So we spend a lot of time educating. But there's decisions that are made. Now, we just had one here in California where the governor signed a bill that is enacting a minimum wage for healthcare workers over the next couple of years. And so we have to work on how we're going to pay for that. There's no additional funding for that. We certainly support strongly the need for our healthcare workers to earn a reasonable living, especially here in a very high cost area and state. We just need a plan and a process and kind of a runway to get there. So we are working through that as well. And there's, obviously other things on the legislative slate regarding seismic building restrictions and things like that we have to work through. So just a couple other examples that we have in addition to the ones that you mentioned there. And we end up with usually about, 10, 12 top categories that we focus on in risk.
And when you are looking at your categories and the rankings, and when you talk about cyber and provider alignment and legislative and some of the other risk areas, I'm sure that those are all very different when you look at them individually. Having multiple locations and multiple departments that span a geographic region, do you see risk variations among those different units or locations or organization or departments within the organization?
That's a great question, in particular for San Diego. I'm going to be honest, before I came to San Diego, I knew it as a vacation spot and have certainly learned over the last 4 years here that San Diego is also a very, very diverse mix of communities and cultures and kind of individual, nuances based on the location and the geography. We have one of our acute care hospitals, Chula Vista, is only about 4 miles north of the Mexico border. And we have certainly seen through some of the federal legislative challenges around immigration and Title 42 here in California of the impact of immigrants coming across the border. And some of those folks have traveled by foot for months and months through Central and South Mexico, through the northern part of Mexico, coming across the border in Tijuana. And at that point, many need some healthcare or are pregnant or, break an ankle, et cetera. So there's lots and lots of impact on those community resources, including our very substantial presence with our Chula Vista Hospital down there that is different than something that you might see in more northern parts of San Diego. We also have clinics down there as well, and they have they provide an impact for that patient population as well. So yeah, there are certainly some differences. We have an East County hospital, the busiest emergency room in all of San Diego, Sharp Grossmont, and they are really the only substantial hospital just due west from the entire Imperial County. So that has sometimes a large impact from difficult issues and emergency room visits from just east of there as well. So yeah, definitely some differences here, and something that I hadn't really thought through before kind of being in the middle of it.
Going back to the end of last year and during this year, there has been reporting about healthcare organizations closing facilities, departments, or ending services to address things like finances and staffing. Finance and staff could be considered as examples of risk. From a broad view over medical care, thinking about closures or other examples, you had mentioned what if multiple things happen at one time? What could be done to strengthen and manage risk and decrease vulnerabilities for a healthcare organization?
So yeah, you're right. It's got the financial impact and all of that is absolutely one of our risk categories. We have a incredible capital plan ahead of us, a couple billion with a B dollars over the next number of years here to be able to expand in the county to provide the services that the San Diego community is used to. We need to build, again, seismically compliant facilities on our hospital campuses. And in order to do that, we have to be able to fund it.
Mm-hmm.
And so we go through a very structured, organized kind of best practice process on a 5-year planning. And we do that. It's a rolling plan every single year and determine really what our financial outcomes need to be, where we need to enact improvement plans. We implemented and started a Office of Transformation over the last year and a half or so to be able to implement system-wide changes on large initiatives to provide savings for the organization. So that happens kind of in parallel with all of the other work that we're doing in order to make sure that we can continue to do the things that we have committed to and our board has supported us to do. So it is right at the front of the risks for us to be able to make sure that we are managing the books in order to continue to invest. Very fortunate that we have a strong balance sheet, very fortunate of our success to date, and it's imperative that we maintain that.
I'll start this next question with a personal note. You and I have known each other for years now because you were my boss when we were at Dignity Health in Arizona. Yeah. I'd like to get your thoughts on risk and resources. I'm going to go out on a limb here because of having worked for you and still connected and friends with individuals that worked for you. I'm going to start by saying people are on the list, not just your direct reports, but the people throughout an organization are important to you. What resources have you found helpful or critical in your work managing risk?
Well, I think that if you are not connected with the frontline folks that are doing the hard work that we do on a daily basis, and that they, can't understand the why for some of the challenges or changes or cost saving measures, et cetera, then you're just sunk. I mean, it is imperative that we connect our frontline staff to the why. Sometimes what's happening is difficult. If we, end up having to close a program, we had to make a very tough decision in the last few months to close our home health agency and the system and to partner with others on the outside. It's always the hardest thing we do. It is, to stand in front of a group of folks and let them know that we just can't afford that business line anymore. It is the toughest thing that any of us as leaders can do. And you just have to continue to connect back to the why, right? The why of Sharp being San Diego's healthcare leader, and that our mission is to continue to provide that care. So I just have had always a very transparent, hopefully, approach and style, and have always been open to questions and criticisms and kind of pushing the envelope. And we've continued that. We have a very open, direct communication to all of our employees. We meet with them very, very often. I will say it's a little bit of a benefit of COVID, of everybody kind of getting used to this whole virtual thing and our employee forums. You set a time for an employee forum and, significant portion of the staff can never come, even if you provide it at different times. It just doesn't necessarily work out. Well, in virtual, you're able to have much more of an impact. And we've seen sometimes, double the amount of employees showing up for some of our forums when they're virtual. Now we're starting to mix them back up into in-person and virtual. So I think you have to rely on your folks. We're here to serve them and to hopefully make their lives a little bit easier so that they can do the real work.
And you had mentioned some things about connecting to those folks and doing that through one of the lessons learned. Everybody's been able to take on more different methods or ways to communicate, virtually and in person. When you look at engaging with those groups, is it a simple just message and there's rounding and town halls? Do you get out there and meet with them individually, spend some time out there? I'm assuming you and your team, you guys are very busy and you have a large organization you're getting with. Virtual and in person, trying to connect with groups like that sometimes can present a challenge and be impersonal when you're trying to create that kind of a message.
Yeah, I think it's all the above. I think it's all the above. It's about being present in person at times. I love rounding is the thing I miss the most about not being in a hospital anymore. I love the ability to, kind of run up and do a quick tour, quick round, connect with folks that are doing that hard work. It's where I get my energy back when I get to see folks do that. I think that it's about being able to do all of those. Not, hear everybody say, are we getting back to the new normal, or is this I think the new normal is the mix, is the ability to meet people on their terms in a lot of different ways. I think personally the most important part of it is consistency, that it's not a flavor of the month, that we're just not going to do this, this forum this way for this quarter and that way, et cetera. It is something that you commit to consistently. Part of the Sharp experience, which is really our entire culture here, but part of the Sharp experience is what we call leadership development. And since the year 2000, for every single quarter, we have brought together all of our leaders. And so that's about 1,800 people in the organization. Prior to COVID, it was done all in person. It was over a couple of different days. And there were topics in there about, again, leadership development. These are all from kind of that lead supervisor level all the way up to our vice presidents. And during COVID, we switched it to virtual. And so I said that we've done it every quarter. We've done that every single quarter, including through COVID, have not missed one. And that commitment, I think, to our leaders in particular, that they know that we will continue to come back. And yes, we do some updating of, the performance of the organization. Where's our scorecard? But we also take issues in the moment as well and respond and react to kind of what our staff are dealing with. And I'll tell you, in the middle of January of 2022, when we were in that surge at that time, we could tell that the organization was just really challenged and hurting and dealing with stress in ways never before. And 2 days before that huge leadership development sessions, we switched the whole topic of the session to, we called it stress first aid. Mm-hmm. And we worked with our behavioral health hospital and those leaders to develop a process to allow our frontline leaders have a place in which they could get help if they needed it, group work and sessions. And it's something that continues on today. And it just, I think, a recognition of the staff's incredible work. So I think it's that just, we can change the how and how we connect with folks. It's really mostly about being consistent and kind of sticking to our word that we're going to continue to be connected.
Sharp has the annual risk process. It recently went through an enterprise risk management project. What are your thoughts before and after since going through that experience? What was that process like?
I think it's for the senior team. So we have a group in the organization that we call executive steering. It's about the 15 or so senior vice presidents, and between them, they run the entire organization, all the operation, the hospitals, the medical groups, all the system services, and finance, marketing, legal, and then we have our health plan, and just all the different components of the organization. I think it's a great grounding time for all of us to assure that we're all on the same page. We individually actually rank, and then we come together to work through what we think is kind of the final picture should be, because then we present that to our board. And we have a subcommittee of our board that is incredibly connected and active with us and identifying, other risks as well. We actually go through in details with each one of them, and the individual subcommittees of the board will approve those risk category rankings, and then it goes to the full board for approval. It's a really kind of an annual unifying process to make sure we're all on the same page as to what's going to eat our lunch, right now. What are the challenges in front of us, and how can we work together? Because I'm not an IT person, right? But I have obviously a significant stake in any kind of cyber activity issues. So we've just worked very closely together. And it's kind of just that one time a year where we all can focus on those issues together.
Well, those processes can sometimes be a big undertaking. Do you see where there can be challenges to that? I always have an analogy of turning the large ship for large organizations or resource availability for smaller healthcare organizations. Sharp is a sizable organization, but if an organization or practice wanted to be proactive but not take on that type of a solution, what would you recommend someone prioritize and implement? Like, are there 1, 2, or 3 important actions that a doctor or a healthcare organization can and should be doing to decrease their vulnerabilities and to strengthen and manage risk?
Yeah, I think you just got to get a couple, smaller organization, maybe standalone. You just got to get a couple folks that can be champions of this. And, as always, choose the folks that have influence and respect. And I think that, again, having the conversation doesn't need to be as broad and kind of complete as ours is. Our process, again, it's a very, very large organization. But I do think that just even that practice of getting a couple senior leaders together to then go down into their leadership to gather some input as well, because we spent a couple months going down into the organization and talking to folks about cybersecurity risk, about legislative risk, and we get feedback from kind of those frontline folks. So again, I think it's a part of the conversation, and I think it could evolve into something larger if you kind of focus on a couple key issues first.
Looking back through recent history, from a risk standpoint, what was expected versus unexpected in healthcare to you, and what could have been done differently?
Well, I think probably in terms of unexpected is here in California is really in particular the issue of kind of those catastrophic events that can happen at the same time. And we saw a little bit of it, right? We were in the middle of a pandemic. One of our community partnered health systems also had a cyber attack at the same time. We had a difficult fire season one of those years. And then just recently, we actually had a hurricane come through San Diego that ended up not being a big deal, but actually was for our Coronado hospital. It's probably the only kind of healthcare facility that got hit pretty hard, and it got hit pretty hard. I think that is the dealing with, the multiple kind of catastrophic kind of outside external, nature type things are very difficult. And, the challenge of oftentimes relying on the same people to help manage that helps to identify sometimes that you need, additional resources or different types of resources. And so that has certainly been a challenge. I think the other one is certainly the things that can sometimes come out of left field, out of the legislator, both again locally as well as nationally, and making sure that you have the right people to understand the nuances of that, so that you can help educate those legislators that are going to be voting on that as well. So it's a team effort.
Now, looking forward during this year, maybe even beyond, what do you see as potential issues and how to be prepared? You mentioned cyber, staff, multi things happening at one time. Are there things that you're looking at that you're saying, yeah, these are ranked higher on our priority list or on our categories that we're expecting that something may happen or come up in one of these areas?
Yeah, workforce is at the top of it, and it because it impacts our access to care. It impacts the ability for our community to get care when you have a reduced number of folks that are providing that care or that are supporting the provision of that care. So that is a significant focus for us and will be for a long time. We've taken some steps to develop internally some approaches to develop our own team. During COVID, we actually built an innovation and education center. It has a full operating simulation center with full patient rooms and operating suites and technology rooms and all of that. And our goal there is to be able to take our current staff and provide them a career that they can envision and to get the skill sets at a single place. It's also connected video as well as with other forms of technology to all of our facilities so that we can have training happen in one way, the right way, high reliability way at one time. And so we've made some investments on that. So that's going to be life's work, though, to be able to impact that. The other one is really kind of strategic agility. Even though San Diego is a very mature healthcare market, our ability to strategically offer services in maybe areas that we haven't before. San Diego is not a growing community. It's pretty level in terms of its population growth. So it's about us being able to understand what maybe market dynamics are happening in certain areas versus others, and how do we be at the table in those communities that maybe we're not in right now, and also to be able to strategically change our business models when appropriate to match the need, as well as to match potentially some, physician partners that, want to look at kind of a coordinated model with us that differently than it has been in the past. So those are probably the two others that are way on the top of my mind, at least.
That's a great point to close our conversation. Brett, thank you very much for your time and sharing your thoughts and experiences today. I really appreciate it.
Appreciate it, Scott. Always nice to talk to you.
Thank you for listening to the Risky Healthcare Business Podcast. You can listen to all episodes from the Resource Center page of the SpringParker website, springparker.com, or click the listen link in the show notes to listen and subscribe for free on your platform of choice. And remember, accelerating healthcare performance is achieved through creativity, not just productivity.